Ladies, here's an important one for you. If you are constantly fatigued, and I'm talking about a deep fatigue, you wake up tired, then there is a very important cause of this fatigue that is commonly missed. And the same cause of this fatigue can give you headaches, can give you dizziness, and can give you cravings for food. I'm speaking about iron deficiency. And stay with me now, because I'm going to show you how it is missed in practice. The reason why it is missed is because iron deficiency can be present without you being formally anemic. So now you're fatigued, you go to your doctor, and a full blood count is tested. Now, full blood count looks at your red blood cells, and they look the right size, they may be the right shade of red, but underlyingly you have low iron stores called ferritin. That's why ferritin is such an important blood test to do. In my practice, I do it once a year on my patients who are still menstruating, which is one of the big reasons why women lose iron. So that is why testing ferritin levels is so important. But now it's also the interpretation that now becomes important, because ferritin, the normal range could be 30 to 280. Now that is a massive range. And you could be feeling fatigued and you could have a ferritin of maybe 40. As you can see, that's to the lower end of the range. So you probably will do well by taking more iron. See if it works for you. Okay, so now you've tested your iron. You've seen that you have a low ferritin. Now we need to do two things. Firstly, we must make sure, what could be the cause? Why do you have low iron? And then we'll get to the treatment just now. So just quickly, a few very common causes is heavy menstruation, but you could be pregnant and you could have malabsorption in your intestine. You could have a history of iron deficiency, or you could be consuming too little iron. And that happens in people that are vegetarian, especially, but also sometimes in people that are meat eaters. You're not getting enough meat. It obviously helps if you are willing to eat organ meats like liver, but I know most people don't like that. If you are a vegetarian, then you will probably have to start focusing on eating the high iron foods like lentils, things like that. But now you've tested your ferritin levels, you know that you're low. This is what I do with my patients. If it's very low, many times, and follow the advice of your doctor on this, it really helps to get an iron infusion, because it pushes up that level really quickly so that you can maintain it with an oral iron supplement. Then the other problem is if you are prone to constipation, you will have to ask your doctor to help you with an iron supplement that does not cause constipation that easily. There are products like that, but that's why sometimes the infusion helps to get you to a nice level, and then you can maintain it from there.